All right, so we're going to be using NMES today on our ACL patient, and he is post-op 2 weeks, and so he likely hasn't been able to tolerate much weight bearing through that, and so he just hasn't been contracting that quad as much as we would like. And so NMES is neuromuscular electrical stimulation, and so we're able to electrically stimulate those muscles to give them a little bit of to facilitate that contraction. And since he has an extension lag, this will help to kind of re-educate those muscles and neurons on how to fire properly together. However, it does make patients a little bit sore and they can fatigue easier than a voluntary contraction. And also you get the delayed muscle onset soreness, and so that's also a contraindication. And if a patient would have a pacemaker or something like that, or if they're pregnant, you're not going to want to use that. Obviously, we don't have a problem with that with our patient here, but those are some contraindications to that. All right, today we're going to be doing some electrical stimulation. So we're going to place these pads on your quad there to help fire them, and we're going to be firing at about 50 to 70% of your muscle of your maximum voluntary contraction. So on this good leg that we didn't have surgery for, I want you to push your leg into me. Good, fire. Good. So that's about 100% right there, okay? So when I'm turning up the intensity, I want you to tell me when we're at about 50% of what you just felt on this one. Does that make sense? Okay, and does that sound okay to put these on and everything? Cool. Yep. I'm gonna have you roll up your shorts for me. And we're using these bigger pads on here because we want to make sure that the density of this current isn't too intense for our patient, and so having more surface area here makes it a little bit more comfortable. So we'll place one here right about at the middle of the quads right there, about where that junction of all of those neurons are, and then we'll put another one here on the VMO. So that is our setup. And then to turn this on, we're gonna do biphasic. So it's biphasic pulsed current, and we are going to turn our pulse rate up to 60, and we're gonna turn our pulse duration up to 300. And then as far as the current amplitude, we're just gonna go as high as the patient can tolerate. And then we're gonna do a ramp up time of 2 seconds so that that's just a little bit more comfortable. And since this is his first time doing it, we're gonna do a duty cycle of 10 seconds on to 50 seconds off so that he can get 10 contractions within our time of 10 minutes. So I have this all set up over here, and I'm just gonna begin turning up this intensity. Let me know when you first feel that initial buzzing, and then we're gonna go about to that 50 to 70% of what this one felt like. Does that make sense? Mm-hmm. Okay.
Okay, I can feel a buzz.
Okay.
And there's some contraction.
At about 50%?
Maybe a little more, we'll get it to 50.
Okay.
Yeah, probably about there.
Okay. And when that's going, I want you to try to also contract that thigh on your own. Good. Perfect. How does that feel? Okay?
Yeah, it feels fine.
Okay. And before placing those pads on, we did check to make sure that there was no open wounds or any type of skin abnormalities that would contraindicate the use of this electrical stimulation as well. Still doing okay? Mm-hmm. We'll get another contraction in about 40 more seconds probably.
Okay.
How'd you injure your ACL?
Oh, I was hiking and then came across a bear, decided to fight it, I kicked it really hard, and
You never win those fights.
well, the bear's dead now, but I tore my ACL while I was kicking it.
You should see the other guy would be a proper sentence to use in this scenario.
Yeah, you should see that bear. It's not doing so hot anymore.
Good job firing that quad. Still doing okay with that one?
Yep.
A little bit, feeling more intense a little bit.
I mean, okay is relative.
All right, and then just for the sake of time, we'll just do the one. And then we'll go ahead and remove these. You might get a little bit of a wax here. All right, and no redness or any burns or anything that came from this, so we are good. Thank you so much.